Hello there. My name is Associate Professor Gillian Farrell, and I'm one of the clinical leads of the Australian Breast Device Registry. I've been asked some questions regarding our recently published paper, Lessons Learned in Implementing Patient-Reported Outcome Measures, or PROMs, in the Australian Breast Device Registry. The first question is, what is the one most important development reflected in your study? We've used PROMs to follow up patients with breast implants in order to identify an early marker of potential underperforming breast devices. This is an important aspect of post-market surveillance. PROMs are one way of assessing the success of breast implant surgery, as they represent a patient's satisfaction with the outcome. The second question asks, what advice would we give a colleague or trainee who wants to implement or replicate this procedure or technique? Our advice would be to use a brief, validated PROM. Ours has 5 questions derived from the Breast Q, developed by Professor Andrea Pusick. This is called the Breast Q Implant Surveillance. We used SMS to communicate with patients, as this is the most economical and efficient method. High rates of response of at least 60% are required to minimise bias. It is important, therefore, to notify patients and surgeons prior to the implant surgery in order that they don't think the text is spam. What's next? Our next plan is to validate the PROM by correlating a low PROM score with the reoperation rate, thus potentially identifying a poorly performing device. It is important to adjust for factors out of control of the operator, particularly indication for surgery, that is, cosmetic or reconstructive, but age is also a significant factor. Thank you.